One of the biggest worries of the elderly is the degeneration of the knee joint, which is really uncomfortable with pain. However, when traditional drug treatment and hyaluronic acid injection are severe, they can only accept surgery to replace the artificial knee joint. From the chart, the first stage of this entire process is pain and swelling through physical therapy or even the patient's own weight loss to relieve joint pressure, while the second to third stages are cartilage regeneration surgery and joints. This is because the cartilage in the joint has ruptured and the gap has narrowed, so it is possible to evaluate the joint with this chondroscope for surgery. As for the fourth period, the whole stream disappeared and the bone touched the bone. It really hurt when it was rubbed. This was a reconstructive surgery. As for the number of total knee replacements in the fifth issue, it means that all the cartilage is worn out and must be replaced. Now there is another option called surgery for autologous cartilage regeneration. It can help many patients get rid of the pain and movement troubles caused by knee joint degeneration.
Step by step, this 80-year-old grandmother has been suffering from knee joint degeneration for a long time. Recently, she underwent autologous cartilage regeneration surgery at Tzu Chi Hospital in Dalian. When she moved to bed the next day, her knee was no longer Kakabi.
It is not easy to support.
In addition, the 55-year-old woman suffered a knee cartilage injury, which made her walk very painful. He underwent the same operation, and after 3 months, his knee pain improved significantly.
Cartilage regeneration surgery uses arthroscopic surgery to enter the patient's knee joint, then takes the healthy cartilage at the edge of the joint and loads it on the so-called carrier. Then we find the position of the defective cartilage in the joint, plant the cartilage from this removed and replant it.
With the increase of the elderly population, the number of patients with degenerative knee joint keeps rising. Ms. Luo, who has long-term knee pain, has previously received drugs and hyaluronic acid injections, but the curative effect is still not significant until he undergoes this new type of cartilage regeneration surgery.
It's truly remarkable. I underwent the procedure at the end of June last year and couldn't bend my feet or right foot at that time. Now I can bend my feet and walk comfortably, managing to walk about 10,000 steps.
What about cartilage regeneration treatment surgery? Its advantage is that the first one is what we call minimally invasive surgery, and the second one is that it does not affect the joints. The cartilage and bone can be preserved, so it has the so-called bone preservation and knee preservation effect one by one.
The minor operation time of cartilage regeneration wound is short, and the hospital can be discharged 2 to 3 days after operation, which can not only slow down the degeneration of knee joint, but also reduce the probability of artificial joint replacement. However, this new type of surgery is currently not covered by health insurance to provide patients with better economic conditions, which is another new treatment option. Comprehensive report from Central News.